Thank you, Dr. Charan Singh, and thanks to Policy Circle for giving me this opportunity to speak to the public. Can you all hear me?
Yes, we can.
Okay, so my association with Digital India, in a sense, has been based on my interest in welfare and inclusiveness. And I'm going to give a very brief overview of some of the things from my own personal history to illustrate how Digital India has developed. So my personal digital journey began in the early 2000s. So it covers basically the period 2000 to 2009. Starting around 2002, we were in charge of the PDS system and everything to do with rations, etc. And two interesting developments happened. One is the issue of leakages became prominent. So from the Planning Commission, we were the first to give out this study to ISI. If I remember correctly, Dr. Shubhashish Gangopadhyay was charged to do a study on leakages. And the second thing is we started looking at the issue of how to address leakages, and we came across an Andhra Pradesh experiment in food stamps. So the issue of leakages is what first started us thinking on this whole issue. And then, and this led me to start exploring the possibility of having something like a food credit card or a food debit card, which could be issued to all citizens who needed rations or food. So that was the initial thinking, which in my mind connected social welfare, inclusiveness with the digital world. In doing that, we had to look at two aspects, which are still relevant today from what I just heard in the introduction. One was obviously connectivity, right? And we divided the country at that time into full connectivity, sporadic connectivity, and non-existent connectivity. And also the issue of competitive supply of food. So in urban areas where we had connectivity, you could have something like a credit card system to issue food where people would get the flexibility. In most rural areas where there would be limited competition of food providers, etc., where you could have some kind of a mixed system with some kind of a card which could connect, or an authorization which was made on the card. And finally, in remote areas where one could think of still having the conventional ration shops and the conventional system added with food banks. So I'm giving you this picture in the sense that this is you'll get a sense this is an old problem, which in a sense has not really been fully solved yet. The second kind of the corresponding aspect of this was that using the possibility of using a private credit card system which already existed, but only partially, and to minimize the cost. However, the realization came that there were multiple card companies which had their own numbers, etc. So that was the seed in my mind of the idea of a unique ID to all potential receivers of food or any other welfare system. The second aspect which struck me was, which took me from leakage, the issue of leakages to everybody having something. And I'll briefly mention two stories which were critical in my mind to moving to this, not just thinking of leakages, but thinking of ensuring every citizen the right he had. One it was a story from Kalanidhi. We had a conference of food secretaries from all over the country in which I participated. And one of the things which shocked me was the food secretary of that time from Orissa saying that somebody asked him, why are you not able to get food to the people in Kalanidhi, which used to be a traditional area of droughts and shortages of food? And he just threw up his hands. So that made me think there is something fundamentally wrong with our whole food system, the PDS system, and what could one do about it. The second aspect was that when I went into it, I found that at the district level, there was something like 250 different central and state programs. Now, if you know something about the districts, the district collector is basically the boss of every district. He has to ensure that these 250 programs are properly implemented. There is absolutely no way, no human way in which he can do that. So basically, they flit from one set of 2 or 3 programs to another. So this exclusion, in this confusion with so many different programs, there were still people who were not getting anything, were not getting food, who were not getting the benefits of any other program. So this was kind of the origin of this thinking that we must have a unified system based on a unified ID system. So very quickly, that led in the 11th plan to a working group which proposed the unique ID system and a multi-application smart card. At that time, we were still thinking in card terms, so a multi-application smart card was proposed by a committee which I chaired, the working group on unique ID and smart cards. And then this was around the middle of 2000s, 2005-06. And this led me, and I persuaded the Planning Commission, the member secretary at that time, to set up a process committee on the UID, which I also chaired, in which we developed the whole concept and approach to giving a unique ID to every citizen in the country, and particularly starting with ensuring that every potential welfare recipient had a UID, and therefore we would not have either the problem of leakages or missing people, or people who don't get anything out of this huge welfare system. There were 2 issues which I just want to mention, which we had to sort out in this process. One was so this was a committee covering all departments of government which relevant to this issue. And one of the tricky issues which we had to address was that the Ministry of Home Affairs and the Office of Registrar General said that we already have this program to identify citizenship. And the important thing which I had to do was to persuade the members that let's leave the citizenship issue aside and give this UID. And after that, you could always define which of the people with residency were citizens or not. And you can see in hindsight, and that was a very wise decision, because the citizen issue has still not been resolved. We still are not able to identify who are the people with UIDs, who have citizenship and who don't. And the second key decision we had to make was whether to use the existing databases or to create an entirely new database. So again, we did a thorough study of the databases existing and found they were actually largely unusable except for the voter ID database. And then we did an actual experiment or operation. We hired a company to do this in an experimental area all over the country. And we finally decided that the best thing to do was to create a completely new database for UID and not depend on the old databases. The old database could be used as a potential cross-check in future. So that is what key decision was made. But the important thing was to persuade all the departments to sign on. So by around the end of this committee, we had come to an agreement. We had worked out a process for giving a unique ID, and the IT department had agreed to put up a cabinet note setting up the UID. So that is where I left it, and you know the history after that, which took a year or so to get that into process, to get the cabinet approval, and then of course appoint the chairman of the UID, who you all know and who took the whole thing forward. The second, very briefly, I guess I've used up a lot of the time allotted, but I do want to mention another issue which was very important and still is. And this was around 2006, the then deputy chairman asked me to do a review of all government services. You know, there was this criticism that we were not spending enough on education, health, but on the other hand, we also knew there were tremendous problems in the supply of nurses, doctors to rural areas, teachers, etc. That we had tried all kinds of solutions to reduce absenteeism, to get people to work there, but had not been successful. So I was asked to do a review of the entire social service system. And what I came to the conclusion, which I mention only because it's still relevant today, is that there was no way to get the quality and access of the kind which could be made available in urban to make it available in all the rural areas without using some form of tele-education, tele-learning, e-education, etc. So this was a very important conclusion that my report gave was, and let me explain in very simple terms. If you look at the population of India, it is roughly 2 times that of US and Europe taken together. And to get the quality level, anything resembling even the average European country would require tremendous organization and resources. So that was the issue. The scalability problem was impossible in my view, and we are still struggling. We are in 2020. We are still trying to improve the on-the-ground system, and I'm not saying that that should not be done, but in my view, the only way to bring up the quality and have a universal access of an equal quality all across the country is through telemedicine and tele-education. So 100% connectivity, which you have referred to, is still an issue, and in some sense, the digital divide issue, my solution to that is that in every primary health center, in primary education center, and any government centers at the local level must provide free access to the poor. Of course, connectivity for the entire population in every village and habitat, but free elements of that provided through the government system at the local level to all those who can't afford it. Finally, the third and final point which I want to emphasize is something which Dr. Charan Singh has done quite well, and I'm sure you'll do more about it, that India has pioneered. He's mentioned, I'm sure you'll hear more about it. India has pioneered digital public goods. I think I can say quite without any thing that the current government has really done a huge amount in recognizing digital public goods, in creating them, and in propagating them. So this is going to be stand out for the future as one of the unique achievements of India in the digital world. The second related aspect of this is digital, what technically I call public good infrastructure, digital public good infrastructure. There's hard and soft infrastructure in that. But one has to, one looks at a sustainable contribution and future to the digital economy, one must have good modern regulations. These took some time. This recognition has taken time, but I think the government is now fully on board for the last 2-3 years, certainly in the second term from 2020, though for obvious reasons, the pandemic had delayed execution of some of these things. But setting up this digital regulatory structure, which also will be unique, I believe. India will have its own unique regulatory system, but based on the best modern knowledge, modern economics. The economics of the digital economy is still very much in process. We don't know even 10 to 20% of the economics we will know with respect to digital economy in 10 years or so. But I think the important thing is that the government has recognized this, is fully on board with this, and that it's trying to do the best in the current circumstances. And given the history I've told you of India, the large size of the population, the whole issue of inclusiveness of rural areas, as you all know, 2/3 of the Indian population, a little less than 2/3 lives in rural areas. So our problems are quite unique, and we will develop unique regulatory and public goods solutions, which again, as you will probably discuss, will also be applicable in many other developing and emerging market economies. Thank you. I think I've taken more than enough time. So thank you for listening patiently.